Good evening, everybody, and thank you for attending. My name is William Batten. The day was December 13th, 2012, and I was in a hospital preparing to go through my first ever surgical procedure. There was nothing special or unique about the procedure. It was a simple procedure that surgeons all around the United States perform thousands of times each year. It was an outpatient procedure, the type that my doctor assured me that I would be sleeping in my own bed that very night. Well, you'd be happy to know the procedure went off without a hitch. Short of some pain and some discomfort, I was making a perfect recovery. 3 to 4 weeks after the procedure, I was starting to feel like my old self. But one day, I walked out to the mailbox, and out of that mailbox, I retrieved an envelope. The envelope held inside it a bill. The bill was for the services rendered by the hospital and the doctors during my surgery. That bill, when I first saw it, floored me. I was not concerned about the amount because I had insurance. However, I was concerned about the total cost listed on the bill. It was over $20,000. It made me wonder, is healthcare reform in the United States necessary? But more so than that, it made me want to know more about the Affordable Care Act that had recently went into effect, which is why I am here today to share with you what I learned. The Affordable Care Act was originally signed into law on March 23, 2010 by President Barack Obama. The law was rolled out over a 4-year time period, and the overall purpose of the law was to make healthcare more affordable, more accessible, and at a higher quality for families, seniors, businesses, and taxpayers. In 2010, a Patient's Bill of Rights went into effect. It provided the patient protection to the insured, focusing on areas such as coverage, cost, and care. No longer could insurance companies deny people care for pre-existing conditions. Also, children who were under the age of 26 years of age could stay on their parents' insurance. In 2011, the Affordable Care Act brought about more change in preventative care services for seniors on Medicare. They were now offered free and reduced prescription medication. In 2012, programs were put into place to help doctors and healthcare providers to work together to deliver better care to the patient. In 2013, open enrollment in the health insurance marketplace began on October 1st. In 2014, access to health insurance for all Americans based on their individual needs. Tax credits and subsidies were in place to help lower and middle income Americans meet their obligation according to the law. The marketplace, which is now currently in place, is meant to help people without health coverage find and enroll in a plan that meets their needs or the needs of their family. Low to middle income earners may qualify for premium tax credits that lower the cost of their coverage, as well as savings on deductibles, co-payments, and other costs. The tax credits can be used right away to lower their monthly premium, and in the event of an overage, that money can be paid back to the consumer at tax time. Applications for coverage can be submitted online, by phone, or with a paper application, and once your application is submitted, it can be reviewed and the eligibility for the coverage determined. The information that I have given you today came directly from healthcare.gov. Thank you.